Hello, Facebook world. Okay, so I am 6 minutes late and I apologize. I'm coming to you live from Jan's deck this time. And while Jade, I took a little bit of your advice, I did not take as much as I should have and make notes. So we were going to talk tonight about how depression is related to your gut health. But instead, if you're tuning in for that, make sure to catch us next week at 6 p.m. Central Standard Time because we'll be covering that next week. And hello, Jan. Instead, we're going to be covering, we're going to take it back a step and let everyone know who I am and why I'm talking about this. So, last week, we had a pretty great response. I was kind of surprised. I think in the last week, without a boosted post, we had about 1,500 views, which was way more than I anticipated because I don't think I'm that interesting, but apparently what I have to say is an interesting topic for people. We talked last week about suicide. We talked about how it is my personal and professional belief that it is a chronic condition. It is not a one-time choice. And my sister, Dr. Jade Dellinger, thought that it would be a good idea for me to let everyone know who I am and why we're talking about that. So that's what we're talking about tonight. So for those of you that don't know me, for the 1,300 people watching, I am Dr. Jordan Leasure. I have a bachelor's degree in business and psychology from Lake Forest College, which is a college in the Chicagoland area. I went on to get my doctorate in chiropractic from Palmer College of Chiropractic. So yay, all my Palmer cohorts that are watching. And I have continued my studies post-doctorally in wellness. I have a certificate in wellness. I also pursued a diplomate degree in neurology. And I am also concurrently pursuing a diplomate degree in internal medicine as well as nutrition. So I have a lot going on at once. I just recently completed my functional medicine studies through, IFM. And I have to do a case study for them and then take an exam, and I will be certified in functional medicine through IFM, which is a subset of the Cleveland Clinic, for those of you that are familiar. And it is the #1 functional medicine program in the country. It's awesome. So if anyone is interested in functional medicine, I suggest you check out ifm.org. It is amazing. And if you're looking for a functional medicine practitioner near you, check out ifm.org. You can search by specialty and you can also search by zip code. So look for that if you are looking for some answers to things that you are struggling with and you want more than just a diagnosis and a treatment of your symptoms. It's amazing, amazing work. So back to why we are talking about depression and suicide. So I, at 18, went off to college, like most of us, and I had some unfortunate circumstances. I had a stalker in college, and it's something that I can, kind of laugh about, joke about now, but it was a serious and uncomfortable situation at the time. I came back from college at 19, and I went to CLC, a local community college, for a year. During that time, I was diagnosed with depression. I had pretty severe depression. I was medicated, like many people that suffer from depression are. And, that was, I am embarrassed to say, over 20 years ago. And, a kind of a slap on the wrist to the medical community, but the treatment of depression hasn't changed much. And 20 years is a pretty long time. So, they still sort of find a cocktail, throw some meds at you. You're sad. You're not feeling as good as you should be. Here's your diagnosis, here's your medication, and go on your way. And for a lot of us, that doesn't work. a lot of, myself included, and a lot of the patients that I see are on antidepressants, and then they're on a sleeping pill because they're not sleeping. And that is a huge, huge problem because it doesn't address the real underlying concerns of depression. It simply treats some of the symptoms. And for a lot of us, I had never done drugs. I still have not done drugs. I had never drank at 18 or 19 years old. And what I noticed being on these medications, and I was also an athlete, and I noticed that my body was not doing what my brain was telling it to do. And that was very, very scary. So I pursued psychological counseling. I went to a handful of different therapists, and you name the degree and I saw them, and I did not see a lot of benefit from that treatment either. So at a little bit older than 19, I took myself off of the medications that I was taking, and I decided to research and pursue other options. And at the time, my mom was smart enough to also continue to look for answers. And we found a therapist that did, at the time, a 24-hour urine catch, and now, which was not cool. And it's a little bit different nowadays. I do just a one-time catch with my patients, so it's much simpler and can be completed at home. But what we did was we were able to analyze that and find out that my issues were actually related to dopamine as opposed to serotonin. So all of the SSRIs that I was prescribed, all of the medications that impact serotonin, which is usually the issue for someone that's depressed, had absolutely zero effect on me. So giving me a higher dose was just impacting other neurotransmitters, causing new problems in my body, as opposed to actually treating the cause. We were just addressing symptoms, and even addressing those symptoms, we weren't making any difference. So when I speak to depression, or I speak about depression, I can do that because I've been there. And, again, it's been almost a 25-year, I don't want to say struggle because I don't see it as a struggle, but a 25-year issue, let's say 25-year challenge. But it is in the back of my mind. Getting pregnant a few years ago, the concern of having postpartum depression was very, very real for me. So I made sure that I was exceptionally proactive, and I ate a little bit cleaner maybe than I would have under normal circumstances. Unfortunately, a handful of women see pregnancy as a free-for-all, and I saw it as a time to create a recipe. I was in charge of building this human, and the raw materials that I provided it at the time, because we didn't find out, the raw materials that I were providing were going to determine the health, the brain power, the personality possibly of who I was giving birth to. So I did everything I could to make sure that I was as anti-inflammatory as possible. So I stayed away from sugar 99% of the time. I did have a few, I literally two, I think, trips to Portillo's because I was craving something sweet. So I did have a cake shake once. And I think that I made black cows for my staff one time. And those were, the handful of treats that I had in 10 months. Hi, Michelle. I also went on to make sure that I was eating as well for his brain as I could. So again, yes, Jade, I'm going off on a tangent here, but when you are pregnant, make sure that you're making choices that are going to not only make sure that the baby is as healthy and happy as it can be, but that you are as healthy and happy as you can be, because PPD is a real thing and can be diagnosed up to 2 years after having a baby. So if you have a baby and you are feeling challenged, if you are not happy, if you are having trouble sleeping, which a lot of us do, make sure that you take some steps, be proactive, and ask for help if you need it. There's absolutely no harm, and I apologize, the sun is setting, so I'm trying to find some good light here. Find some help if you need it, reach out. One of the comments, getting back on track, that I got last week about our talk was someone that had tried everything I suggested. So she had eaten very well, she was exercising, and the only thing that helped her was medication. Now, please be aware that as a wellness practitioner and a functional medicine doctor, that I by no means advocate that anyone should get off of their medication. And I will tell you that in the 15 minutes that I have with you, I do not think that I am ever going to be able to explain depression or give suggestions to depression, because it is a very complicated physiological and psychological issue. So when I am making recommendations or making suggestions, whether it's the breathing exercises that I tell clients that they should do, or getting out and being social, or getting out and exercising, do I think that that is a diagnosis and treatment for depression? Absolutely not. So please do not be mistaken. But now, those are activities that everyone, regardless of how happy, healthy, and energetic you were feeling at the time, those are things that everybody should be doing, especially if you are not feeling as happy, healthy, and energetic as you could be or as you should be. So my advice this week is to take a few minutes today and think about when the last time was that you felt healthy. Was it earlier today? Was it last week? Was it 5 years ago? Or can you not remember? All of us should be able to say within the last week, last 10 days, that we felt really, really good. And if you don't know, there are steps that you can take to get back there. So please feel free to reach out to me with questions. Reach out to me if you need a referral to a functional medicine doctor in your area, because there's a lot that can be done. And again, I am planning on covering a handful of different topics related to this. Again, depression, suicide is a very, very complex, very, very in-depth issue, and it's very individualized. So please do not be mistaken in thinking that I am diagnosing anyone, that I am giving a cure-all or a recommendation across the board, because I absolutely am not. Next week, when we cover how gut health relates to how you're feeling, I'm actually going to share a printout with some of my functional medicine advice on it. And it is going to show just a handful of the interplay between our gut health and our hormones and our nervous system and even our immune system, how all of that plays with how we are feeling and how we are thinking. Because again, depression is a very, very complicated issue. But going back to the subject, I will reiterate, I do not think that suicide is a quick, one-time choice thought culminating in an unfortunate action. It is a very complicated, long process, and it should be diagnosed as a chronic disease. So in wrapping up, if you missed last week, please take a look and watch. We covered some fantastic breathing exercises, and we covered the importance of social health. So I want to reiterate to everyone, you've had a week to practice, and I hope that you have been. So make sure, I'm going to move, that's not helping. Make sure that you are working on your breathing exercises, that you are breathing from your stomach, that you are not breathing from your chest. Make sure that you are doing a gratitude journal every evening. So think of 3 things that you are grateful for. Again, even if it's the fact that you made it through the day, some of us, that's all we have. It can be a challenge. And then finally, make sure that you are out there, you are getting active, and you are interacting. So those of us that have thousands of friends on Facebook, how many of those friends did you see in the last week? How many people did you actually interact with? If it wasn't that many, take a look and find somebody near you, send them a card, or take them out for coffee. It will improve your health, and it will improve their health as well. So next week, we are absolutely going to cover gut health and how it will impact how you're feeling positively and negatively. If you have questions or you are excited by what I'm talking about, you can find me at www.drleasure.com. And please spell it DRLEASURE.com. If you spell it the other way, you're going to find a nude beach. And if you are struggling with how you're feeling, if you are looking for supplement recommendations, the supplement company that we use and we endorse is salutogeniclife.com. Feel free to find us there. There's some excellent blog posts on mood, on energy, on activity. And I hope that some of this was beneficial. If you liked it, if you learned something, please share with your friends. Again, I'm Dr. Jordan Leasure with North Shore Proactive Health, and we will see you next Wednesday night at 6 p.m. for our Wellness Wednesday chat. If you have questions or there's a topic you'd like to hear more about, please feel free to send me a message. If we talk about your suggestion, you'll get a free gift. We'll talk to you soon. Love you. Stay healthy. Bye-bye.